Good afternoon, friends and future doctors. Today's topic is on classification of stitches and types of knots. In the previous video, we talked about primary, secondary, and tertiary intention. So, what is the point of making a suture if you cannot tie it or make a stitch? So in this video we talk about the types of stitches and we talk about the types of knots. So what type of stitches do we have? Following are the type of stitches that we have. The first one is known as a simple interrupted stitch. In a simple interrupted stitch, the wound is usually a fair, nice, straight wound. So in a fair, nice, straight wound, you want to make it as simple and easy for your assistant to tie the knots. So you make a simple interrupted type of stitching. But in the case where your assistant is not that confident in himself, you want to do the work alone, you go on and make an interrupted suture. First you tie an interrupted, you make a continuous, you make a simple continuous stitch, which is also known as simple running. So in the simple continuous stitch, you make a first knot over here, and then the rest of the way you go up to the end, and when you reach the end you make the last surgical knot and you're done. So usually we use this type of stitching when you are alone and you do not have an assistant. In the case of vertical mattress, usually the edges are hard to reapproximate together. You remember what we talked about? What is a suture? A suture is material that you use to reapproximate edges of a wound. So over here, you have a far kind of stitching, and then near. With this kind of incisions on the skin, you're going to have what we call a vertical mattress. So the suture is going to look like this, and it will be easier for your assistant to make the knots over here. They do not have to pull through the skin like here, as you can see on the simple interrupted, but they will have to just tie at the base here, and the skin on its own, as you can see over here, it approximates itself. Okay, then the other type of suture, I don't like to call it a stitching method, or just like to call it a skin stapling. This actually approximates skin way better, and it has a better scarring as compared to using suturing material. And then the other suturing material, the other stitching type I want you guys to know about is the cosmetic one. This cosmetic one is made through the dermis. As you can see, you go through the dermis just right below the epidermis, and you bring skin together. You will not see the suturing material, and it looks so beautiful after the suturing is done. And this one is the one they use usually for plastic operations, or when you are doing a mastectomy, when you're removing the breast tissue. This is the type of suturing you use because you want it to be as cosmetic, as beautiful as possible. This suture stitching is also known as subcuticle. Okay, this type of suturing stitch is known as the purse-string stitching. The purse-string stitching is important when we are doing an appendicectomy. When you're doing an appendicectomy and you have to close the stump inside, you use this type of stitching. So you basically stitch around the wound, and then you place in this tube. This is in the case of a gastrostome, when you are going to be feeding a patient through a tube because they cannot swallow food over here. There is a blockage. So what you do, you place this gastrostome, this tube, into the stomach, and then you just put fluids into the stomach from here, and the food will just go down the intestines. So now how do you make sure that this tube is attached perfectly? So what you do is that you place the tube inside, and as soon as the tube is inside, you start stitching around. When you stitch around, you just pull, and when you pull, it will close up like this, and that's the only way this tube will be attached to the stomach for a very long period of time. This type of stitching is known as purse-string suture. You know, females have got small bags which they call purses, and sometimes they do not have a zip. Yes, so there is no zip. This is the purse for a female. This is the purse, and this is the top of the bag. Yes, sorry for that. This is the top of the bag. So this is the top of the bag, and there's a zip over here in usual cases. But in some cases, you actually don't have a zip. You just have a rope that is going around the bag like that. And when you pull this rope, the bag is going to close. So the bag will look like this when you pull the rope. It will close up like that. When it's open, it will look open like that. When it closes up like that. This is the same with the purse string. So when you press this string and you pull it, it's going to look like this. Anyway, this is what you needed to know about purse string suturing. The other part of this lecture, which is very important, is understanding what surgical knots are. Understanding what surgical knots are is important because when you be tying knots on different tissue, for example, when you're tying the aponeurosis of the peritoneum, if you are new to stitching and tying knots, I would advise you to use a double surgical surgeon's knot, because with this double surgical surgeon's knot, as soon as you pull onto the tissue, it goes and it attaches without any movements. But when you are experienced, you can do this simple knot, and you can tie 3 or 4 of these simple knots, and it's going to be as tensional, as tight as the double surgical throw. You only do the double surgical throw 2 times and you're done. With a simple knot, you go 3 times to make sure that everything is working fine. And then the last one I want you guys to know about is the instrumental stitching. The instrumental stitching is important because this is the first type of stitching a student should know. So you basically make an incision, and you take out your incision from here, and then you get your instrument. Next step, sorry for that. You get the instrument, you place it there, and you pass the string 2 times, and then you pick up the end of the string as so over here, as you can see on number 4, and you pull, as you can see here on number 5. And once you pull, it's going to attach completely. It's going to attach. When you pull, it's going to attach completely. And then you go on for the second throw. When you do the second throw, you just pull, and it's going to attach very, very nicely and perfectly, and you will have no problem with the tying you have made. So these are the surgical knots you should know. The first one is a simple surgical knot. Second one is a double surgical knot. And the third one is the instrumental surgical knot. And then on the classification, I want you to remember the following classifications. For suturing. Just 1 second, let me just make sure I can zoom out. Good, this is perfect. There is the simple interrupted for the professionals who have got an assistant, luckily. And then there is a simple continuous over here. Simple continuous for the people who are professionals but they do not want to waste time because they do not have an assistant. Then the third one is for people with an assistant who is not so good at approximating the skin together. So you try to make sure that the assistant is comfortable. This is the type of suturing that we use usually in the operating room. This one is the one we use the most, the vertical mattress. And then there's the staples, which are used usually, and they usually make a very good scar. I like this type of suturing. And then the subcuticle, which is cosmetic. This one is loved by the women because they can go to the beach and sunbath afterwards. And the last one you should remember is the purse string suture. The purse string suture is the one you use for attaching a gastrostom, or when you're closing up the stump after an appendicectomy. This type of suturing is very common and usually used for the dead end of a cylindrical tissue, for example intestines, for example the stomach. This is the kind of string we use. Thank you so much guys for watching this video until the end. I hope you have learned something, and as I always say, watch these videos again and again. It is the only way you will remember. And the goodness is you do not have to study so many times, because once you listen and you see, it's easier for you to remember. Good luck and keep studying. Bye bye.